Thank you, Adrienne. Thank you so much for having me. Thank you, everyone, for being on. I see we have people all over the country, which is amazing. California, Missouri, and we also have New Jersey. I'm from Jersey, so I still consider myself a Jersey girl at heart, even though I am in Connecticut. So I'm really excited today to talk about navigating tick-borne infections and insights into Lyme disease, Bartonella, and complex chronic illness. So we'll be here for about 55 minutes, and then I'm going to leave about 5 minutes for Q&A. I don't know what happened, but somehow I don't usually do this. My slide deck is incredibly large. You guys will have access to the slide deck. So hold close to your seats, and I'm going to go through all this content. Try to make sure I do it in a pace that's not too fast, but at least enough of an overview so you all feel comfortable when it comes to just approaching care for Lyme disease, Bartonella, Babesia. We're going to talk about other co-infections, even like Anaplasma, Ehrlichia, and other viruses. My story, I got into been practicing as a naturopathic doctor based out of Connecticut for the last 16 years. Myself have had Lyme disease, Bartonella, and Babesia, all the trifecta, all three of them. And I have a family history of autoimmune conditions. So when I first got looked at and worked up for it, they automatically went down the path of autoimmune conditions. And so many years later, based on the symptoms I had, and actually in me working with patients and treating patients with Lyme disease, my patients actually showed me what I needed to know for myself was what that I actually had. I actually got worked up and had these same tick-borne infections, and so that was my own path. Also had family members that have had it, and so to me, it's really important this information gets out there because oftentimes the average consumer patient sees about 7 to 9 doctors, at least 7 to 9. Many of mine have seen a lot more before actually getting diagnosed with Lyme disease. And if they do get treated, it might be a really short stint. They're not retested, et cetera, or they continue having what's called post-treatment Lyme disease symptoms. And so they're going to come to our space. They're going to come to see functional medicine providers, integrative medicine providers. They're going to come to see us because they've often slipped between the cracks, like myself, who saw two rheumatologists, saw primary care doctors, multiple doctors before finding out I had it myself. So, what are we going to go over today? So, we're going to talk about the prevalence of Lyme, Bartonella, Babesia, clinical manifestations, diagnostic, and laboratory testing. I'm going to be focused on the lab I'll be looking at today is IGeneX, but I am going to talk about some conventional labs that should be worked up as well. Integrative treatment approaches and prevention strategies. Now, when I do the boot camp, we are having more of an advanced boot camp on the co-infections like Bartonella, like Babesia, Anaplasma, Ehrlichia. Now, those co-infections, we're going to go into a much deeper dive because we have 6 weeks, right? And so this is a very complex topic, and everyone has different levels here, I'm sure, listening in over the course of the hour. But that dive is going to be a lot deeper in the boot camp session. Okay, so why is this important? So I touched upon it already. Many people see 7 to 9 doctors before getting diagnosed. My goal is that if you see them the first time, you're the first one to diagnose to not delay symptoms, and so people do not have these post treatment symptom Lyme disease or tick-borne infection symptoms. So I thought this was interesting to start off with. There has been a shift in the epidemiological landscape of infectious disease of just tripling, quadrupling within yearly outbreaks or tripling. And so there's many more human diseases over the past 25 years, and there's continued research to see what potential viruses can be transmitted from animals to humans. I know there was just a recent approval with the government. I think it's 30 or 35 million dollars to invest in greater study for Lyme disease and tick-borne infections just in the past couple of months of proving. In Connecticut, the place that actually tests at Yale has gotten so overburdened with the amount of ticks they've tested and new species, infections getting transmitted a lot faster. So this is evolving research of different even subspecies of what we're going to be speaking about due to things like climate change, weather changes, where there's just higher amounts of ticks than we used to have even before, and also other potential viruses coming down the pipeline. So some of the reasons why: travel, most important viral transporter is mosquito. Also, us expanding towards wilderness, which provides an opportunity for viruses to contact humans and domestic livestock. So let's do a quick overview. About 500,000 individuals are diagnosed each year with Lyme disease. That number definitely, and tick-borne diseases may be much higher than that because that is if someone is actually worked up and that blood work completed. And as we know, based on the studies, a lot of the lab tests, the standard lab testing is faulty. And the warming climate has increased emergence, and the Lyme population has doubled since 1991. And typical transmission is about 36 to 48 hours. However, viruses like the Powassan virus can transmit as quickly as 15 minutes. So that's an important factor because a lot of people will say, I came in and out, I didn't see anything on myself, so I couldn't have gotten it, even if they have symptoms that are consistent with the tick-borne disease. But some, such as Powassan, can transmit as quick as 15 minutes. So discovered, again, an overview in 1975 with children in Lyme, Connecticut, were getting diagnosed with juvenile arthritis. Willie Burgdorfer, who discovered Rocky Mountain spotted fever related to rickettsia, they actually started testing and treating these kids that were having the JRA with antibiotics and saw benefits. And so they tested it, and then that was later referred to as what's called Borrelia burgdorferi. So other diseases that mimic. So you'll see rheumatoid arthritis, you'll often see MS. Lyme disease can cause plaques in MRI scans, just like MS, and an overlap of symptoms, especially if there's a tick-borne disease like Bartonella, which will impact the neurological system more, fibromyalgia, chronic fatigue syndrome, and even ALS. So in practice, I've seen pretty often, because I see Lyme disease, tick-borne infections, as well as autoimmune conditions, seen a lot of people, a ton of people with rheumatoid arthritis that were never worked up for these tick-borne diseases. And then when I find that they're positive and we actually treat them for Lyme disease, you'll see the rheumatoid factor titers clear. You'll see those same symptoms they had with like pain in their hands, pain in their hips, pain in the knees go away under Lyme treatment. So I've had many patients that were diagnosed with RA, even on steroids, that once we actually treated for Lyme disease, those markers either cleared, including things like ANAs, and also their symptoms improving. So this is just how it could be found, especially when you're looking at sometimes people you'll hear is persister or stealth infections, and those are in round body forms, and those are trickier. So those are people that about the 15% of people after being treated for Lyme disease that continue having those symptoms. It can occur year round, but there are diagnosed cases every single day, including in the dead of winter. So a lot of people think it's not available in the winter. A lot of people think it doesn't happen in urban environments. I have many patients from New York City, so that is not true. But it's the highest from May to July because that's the highest reproduction cycle, and they reproduce more in the spring. But again, all year round. Four main species include Borrelia burgdorferi, Borrelia myomete, but you'll also see across, especially depending on where you live in the country, something like Borrelia afzelii. It's common in Europe and Asia, but you'll also see that, for example, in California, and Borrelia garinei. And so this is a schematic from a mapping, rather, from IGeneX on the locations. And as you can see, we have it throughout the country. So we have, for example, oops, this thing is covering my screen, so I can't see it. Okay, there it goes. So Lyme disease here on the top left-hand corner. And you could see, again, I'm in Connecticut, so obviously it was initially found here and very common in New England and East Coast. But as you can see, there's definitely pockets throughout the country, very much on those coastal sides. And so this is just a mapping of that tick-borne relapsing fever, Babesia, Ehrlichia, Anaplasma, Bartonella, as well as Rocky Mountain spotted fever. No one, again, is a great imitator. Through testing, you can know for sure, but per CDC, to be clear, it is a clinical diagnosis. So you shouldn't just just base your answer on the test results. Sometimes it might be necessary to consider looking at things like treatment if they present with all the symptoms, even if they may be negative by way of testing. So most tick-borne diseases present all 50 states. I talked about travel and also that the tick population continues to grow. So in terms of presentation, we have what's called erythema migrans, 3 days to 30 days. It's warm, not itchy. So that's a peculiarity to it. It shouldn't be itchy. It's more so warm to touch. It could spread as much as 12 inches. I've had patients that have had multiple EMs too, rashes, where they'll have multiple bullseye rashes, like 5 or 6 on their body. I've even had people, when they've gotten treated, when they get better, these rashes will appear. And in naturopathic medicine, we learn that as that the Herring's law, where it goes up, down, inside out. And so sometimes you'll see this like going backwards in symptoms. And so sometimes they even had patients have these like bullseye rashes after the going treatment. And they actually had said they had never had one before, or don't recall having one. But again, a percentage of patients, almost half, do not even have an EM rash at all. There's also, this is just to look to see it can present different on the way it presents. It's not the classic bullseye, which people know here in the bottom on the middle. This is also how it can present. So let's look at the symptoms. Typically, again, I said 50% bullseye rash can also look like a spider bite. I remember when I had mine, it looked more like a spider bite. My father, who had one, looked like a spider bite until we actually got him worked up for Lyme disease. Initially, most people have physical symptoms: fatigue, muscle pain, headaches, fatigue, swollen lymph nodes, Bell's palsy, racing heart, brain fog, and memory challenges. And those will start going deeper to impact the neurological system, like seizures, eye pain, numbness, tremors, etc., as well as even things like encephalitis. And people can have continued chronic Lyme arthritis as well, typically affecting the larger joints like the hips and the knees. So you'll see that more commonly with tick-borne with Lyme disease. And we look at Bartonella. Bartonella is also known as cat scratch fever. It can be transmitted from cats and ticks. I wanted to make mention of that because patients ask that all the time. I don't have a cat, so I couldn't have had Bartonella. Yes, you very much can, because it could come from a tick. And what it'll look like is like a cat scratch. And the interesting peculiar with that is you'll see sometimes they get confused with stretch marks because they look a little bit similar to stretch marks. But what you'll see is that it's not consistent with what normal stretch marks might look at. So I'll have somebody with, it looks like a scratch down their back that's going diagonal or going the reverse of where growth lines are. And so that's a peculiarity you want to look at, like physical findings when you do the physical exam and someone does have, let's say, Bartonella. Do you actually see these actual marks on their skin as well? Because it's pretty common. And sometimes they'll have it and they don't test positive for Bartonella. And so some of these infections like a Bartonella or Babesia that affect more neurological system might require retesting before it actually shows positive. And so that's why you want to look at that, match with the clinical symptoms to decide how you're going to move forward. Symptoms include neurological symptoms, fatigue, numbness, and tingling, headaches, insomnia. Insomnia is a pretty common symptom with Bartonella, as well as swollen lymph nodes. Headaches are another one. You'll also see that with Babesia as well. So Babesia, you'll have Babesia microti and Babesia duncani, the two most common ones. Similar to malaria, it's transmitted through tick bite, also blood transfusion, and you'll have these undulating fevers and profuse sweating. For me, Babesia was probably the most prominent symptom I had. At that time, I was in naturopathic school where I was just drenched hot all the time. And of course, at that age, and you'll hear from many patients, it's in your head, you're anxious. This is just anxiety. But the thing that didn't make sense to me was I would be going grocery shopping and I would be really hot and just break out in a profuse sweat, which was not anxiety producing for me. So that's a really common peculiar, sometimes symptoms worse at night. People will say they have what's called like air hunger. So it's not, or shortness of breath, not like asthma where they're wheezing, but they feel like they can't take a deep breath in. It's somebody that says, I walked up the stairs and I have shortness of breath and I'm an athlete, I'm a runner. Like I shouldn't be tired just going up the stairs. It doesn't sound like it's deconditioning. They just feel like they can't take a deep breath in. Also, some of the common symptoms for Babesia is even feeling of a sickness of nausea, digestive issues, fatigue, joint pain. It can even cause hemolytic anemia. So you'll see that also for Bartonella and for Lyme disease, you can see these changes in the white blood cell count that can go lower, can also happen for somebody with an autoimmune condition. And also you may see anemia as well. So it's always important to not only look at the complete blood count, also making sure to check things like iron and ferritin, et cetera. Ferritin can go out when there's acute inflammation just with a virus. And so that can also get depleted. So ferritin is also something that's really helpful to look at and can actually change with those tick-borne infections. Also, Anaplasma ehrlichia. These are other common co-infections, very similar by way of symptoms: fevers, chills, muscle aches, severe headaches, and can also change the white blood cell count. I just wanted to make mention just quickly, I always like to make sure to look at other infections that could be factoring in. So you really want to get, obviously, the full case workup. But if someone is having a lot of fatigue, you want to look at things like EBV. Was EBV reactivated? Not just IgM. About 85% of the population has IgG, but you want to check for EBV early antigen, IgG, to see if it was reactivated. Oftentimes, it can get reactivated from getting COVID, from getting the flu, also from Lyme disease. And that might be it. When what that means is they might still be presenting with the symptoms as though they just got a recent infection of mono because of that reactivation. So I'm always looking at that. Strep, especially for kids. If there's symptoms for pans and pandas like OCD, insomnia, overnight changes, personality, tics, anxiety, etc., that is another one you want to look at. And then also mycoplasma. So mycoplasma, walking pneumonia, it overlaps with a lot of symptoms of even Babesia with fatigue or air hunger, trouble breathing, shallow breathing. So I just said Babesia can have that too. So you want to look at that as well. And also, Babesia as well as EBV tend to be more persistent. Mycoplasma is considered more of like a stealth infection. So you could see people be positive for a long period of time, particularly if someone has a history of asthma, can be months and months after having acute pneumonia. Also, you want to look at demographic differences. So I mentioned how it can look differently on the skin. So this is a person of color. You can see how much differently it looks, or it can be seen as a spider bite, for example. And so if you look at people like for different darker skin, for example, in one of the studies, it showed 34% of blacks showed neurologic signs of Lyme disease as compared to 9 for whites. And that is likely and also diagnosed outside of Lyme disease, likely because the diagnosis was just late. And so at that point, the disease became more advanced because it was not actually taken care of. Women as well, women's complaints of pain, as we know with studies, but as well with Lyme disease, tends to be more dismissed because many of these symptoms are nebulous, like brain fog, forgetfulness, insomnia, anxiety, palpitations. This can also happen during life transitions like perimenopause and menopause. And there tends to be more diagnosis for things like Lyme disease for women, as well as actually autoimmune conditions around that same time in life. So making sure that's also looked at. Also, if you look at the diagnostic testing, not only is the testing faulty, we already know that there's some issues with getting it in through the conventional standards. More men than women will also test positive for Lyme disease. So multiple reasons, also hormonal shifts actually are very protective and supportive for the immune function. I do a whole session on that when I do the boot camp on like hormones and its impact and how that can alter immune function, which is more pro-inflammatory, which ones are more anti-inflammatory, like testosterone, how those can get blunted as well in times of inflammation and infections. So, also, I just wanted to, again, going through tons of content fast, making sure you look at other connections, infections, and autoimmune conditions, three different mechanisms: molecular mimicry, bystander activation, epitope spreading. I don't know why the font came out this small on this, but didn't look like that on my end. But even though Lyme is not an autoimmune condition, especially when it's post-treatment Lyme disease, it can compromise the immune system and also lead to the development of autoimmune conditions. The one most connected is MS and RA. One of the reasons is the outer coat of Lyme bacteria is similar to tissue found in the nervous system, and the immune system reacts basically to this leftover tissue and attacks these neuronal tissues as well. And so this bacterial tissue that's not eliminated, it basically confuses the immune system as a result. So when you look at some of the pieces as it relates to infections like Lyme disease and its relation to autoimmune conditions, Borrelia burgdorferi, 60% of untreated patients develop arthritis that can last for several years and are found in the joint fluid by PCR. And then cellular and humoral responses develop in 70%. So the majority of patients that have antibiotic resistant Lyme arthritis will have this response with the surface protein. And then again, research has shown Borrelia burgdorferi has triggered development of autoimmune conditions like RA, like MS, SLE, particularly if you have a genetic predisposition. So someone like me, whose mother has lupus, my aunts have lupus, rheumatoid arthritis, etc., we are at a genetic predisposition. So if you have a patient family history of that, these infections may be the antecedent, might be the what preceded this autoimmune condition. And so we might be actually helping to prevent a future long-term autoimmune condition when we're helping to address tick-borne diseases. Also in the studies, they showed Bartonella. So you have a younger person, Bartonella has been commonly connected as a PANS trigger, and Babesia and Ehrlichia has been connected as well in studies with the development of arthritis. So let's talk about, I'm going to go into a little bit more deeper dive into Babesia and Bartonella because they tend to affect more the neurological system. And so how does that affect the neurological system? So it's shown to lead to damage. They have had studies with Babesia to the blood-brain barrier, and Ehrlichia has also shown to target the neutrophils into the endothelium, which causes this pro-inflammatory response that can cause the blood-brain barrier damage. And oops, this is a duplicate. Sorry about that. So that can cause that issue. And so when you look at the blood-brain barrier disruption, there's high levels of systemic inflammation with greater chronicity. It creates greater blood-brain barrier permeability, which increases lymphocytes as it causes infiltration of innate immune cells. And this disruption causes a few things to happen. So one, the signal change. Then there's this increase in cellular traffic and also increase in the solute permeability, and then there's the direct damage. So these endothelial cells express receptors and they respond to the inflammatory mediators interleukin 1 beta, IL-1 beta, IL-6, TNF, and cyclophilin. And the activation of microglia is a hallmark of brain pathology. It basically serves as a brain macrophage. It helps to mediate neuroinflammation and it expresses multiple receptors for neurotransmitters, including GABA, dopaminergic, and cholinergic receptors. And it's regulated by pro inflammatory and anti inflammatory cytokines. So, these inflammatory markers have a huge effect on the mental health aspect, particularly studied with depression, anxiety, and even schizophrenia. So we definitely need to look at when we're looking at these infections or tick-borne infections, particularly things like Babesia and Bartonella that lead to damage in the blood-brain barrier. These inflammatory cytokines that increase up can cause issues that are going to affect not only the neurological system, but also the mental health state of a patient that you're working with. Infection role has been connected with many viral diseases here, anxiety and depression. Tick-borne diseases support symptoms of significant and anxiety and depression months and years post-treatment in the studies. And parasites and bacterial infections can contribute again to other illnesses. So, what are some of the laboratory tests? Per CDC, again, as a reminder, it's a clinical diagnosis. If you're going by conventional test, the IgM, or it's 6% test negative when you're looking at things like the ELISA. So you have IgM, which is 2 bands have to be positive, and then IgG, which is 5 positive bands. I wanted to make sure that many of you may be more advanced, but many people don't know that because I have providers call and there's confusion about they only have 2 bands. They're fine, but they're 2 bands IgM, which is considered a positive finding. Western blot is more accurate. It's going to be showing the bands, but oftentimes it'll reflex out from the ELISA only if that's positive. And again, if over 50% are false negative, we really want to make sure we're working with the lab vendor that is more thorough in the qualitative analysis or what they're using for their species so that we're making sure we're getting the most accurate test. IgM generally won't show for about 3 to 4 weeks. And one of the reasons why you want to wait for testing as well, although we'll talk about IGeneX. IGeneX does have the T-spot test. So if you have someone that's immediately infected and they want to know right away, the T-spot test would be the most indicated. And you can have both IgM and IgG. So you'll have some people that have the IgM and IgG bands for a long period of time as they're getting treated and you're checking. So this is just an interesting study here. IGeneX did a study with 10,000 patient samples from nearly every state, and 37% were positive for Babesia, 32% for Lyme Borrelia, 27% for tick-borne relapsing fever Borrelia, and 19% for Bartonella. So 40% tested positive for at least 2 pathogens. So this is why it's important that you're testing more than just Lyme disease, especially based on what they're telling you by way of symptoms. and 15% tested positive for 3 pathogens. When you look at autoimmune conditions, most autoimmune conditions have at least one, mostly two, chronic and persistent infections that precede diagnosis. So, again, more reason why we want to really look at that tick-borne diseases because, especially in a person that has a genetic predisposition with autoimmune conditions. So most Lyme tests just study for B31, Borrelia burgdorferi B31. And so what happens is they might be testing for the wrong species, especially if you have a patient that travels a lot, goes to other countries, et cetera. You definitely want to make sure you're making sure that they're working with a test that includes multiple species. So there's what's called direct testing and indirect testing. So the direct testing, what that does is it looks for the bacteria or parasite in the blood itself. And the indirect testing, which are like the Western blot, immunoblot, et cetera, looks for the body's antibodies to the bacteria or parasite. So when we look at IGeneX, they actually have both direct and indirect testing. And we will actually show that now from here. This was launched in 2017. When you look at their immunoblot, it's actually covering, as you see, I wish I could have my cursor working, but you can see all the different subspecies they're checking as compared to the standard test, which only tests for B31. So now you have that sensitivity, which I mentioned was only like 53. This is actually 57%. Now went up to 93% because of the fact that you're checking for 8 species rather than just the B31. This just shows basically how the immunoblot, how it's different. It's more controlled. It's sprayed directly with a precise amount onto specific locations. So it's much more consistent and accurate. And it also reduces just overall false positives and false negatives. Now, I mentioned there is a test IGeneX has if it's earlier than the 3 or 4 weeks and someone has an erythema rash and you want to find out earlier, they do have a new test. It's called IgX spot test, which is great for early infection. And then again, the IgM and IgG develop after. And then what happens is that you see this like picture where it goes up initially, it's the T spot, and then it'll go down and then reappear later. So that's something you want to consider. If you are doing that testing, it really has to be during the week so it can make sure it arrives to the lab within 24 hours. So these are some of the species testing that they're doing now. You can get all of this actually on the website with IGeneX. And this is just more information. I'm going to try to go through that fast. So the patient is positive for Lyme IgM by both IGeneX and CDC criteria. So when you're looking at this test, for example, they have on the bottom left the IgX criteria as well as the CDC criteria, so you can overlap to see them. So when you look at the conventional tests, for example, they remove bands 31 and 34. And the reason is because of the Lyme vaccine that was done some years ago. And so if you had the Lyme vaccine, you would be positive for bands 31 and 34. And for that reason, they actually removed it from the conventional standard, but it's test. But however, how many people have actually gotten the Lyme vaccine? So it is actually very specific. They're all a little nuanced, and that's what we go through in our boot camp as well. Even the bands are nuanced of like kind of symptomatology that it's connected with, but does include things like 31 and 34, which are removed from the traditional test. This is also pieces on their tick-borne relapsing fever. Another one you want to do, especially if someone is having a lot of undulating fevers. Most tests will only look at myomate, but you can see this test for multiple ones listed here and with a higher sensitivity as well as specificity level. And then this is just information on the different tests that are completed, both direct and indirect, for both Babesia and for Bartonella. And actually, they recently, IGeneX, added Babesia immunoblot for Babesia microti as well as Duncani in the last year. So that's actually a new change. Before it was just the PCR and fish testing as well as the other indirect tests, the IFA test. So this is also information about the Bartonella immunoblot. Does 22 Bartonella specific or recombinant antigens. And then in addition, it also speciates it by these different 4 Bartonella subspecies. Like I said, I don't know why the font is like crazy small here, but these are the other markers we want to check. You want to look at things like HSCRP, CRP. If someone's over 10 for HSCRP, then it's definitely related more to full body inflammation. CRP is the first one, and usually within the first 6 to 8 weeks, that'll go up with inflammation. Interleukin 6 actually before that. So that's another marker you may want to check, as well as ESR. Epstein-Barr virus, I mentioned other viruses to look at. You want to do EBV, early antigen. And then I just like to look at other tests like hormones, DHEA, testosterone, FSH, LH, estrogen, other markers as well, and viruses like mycoplasma, I mentioned, like potentially if so, we suspect PANS or pandas, ASO, which is anti-streptolysin O, as well as things like anti-DNase B. And also, you always want to work up a full autoimmune panel as well. These are some other inflammatory biomarkers, and these have been connected, most connected with neuroinflammation that has mental health affects. And so I wanted to put those down, especially if your patients are presenting with that. IL-6, IL-10, IL-10, IL-12, TNF alpha, soluble IL-2 receptor, IL-1 receptor, interferons. CRP, again, is shown to be predictive of depressive symptoms, and CRP of greater than 3 has been observed in 25 to 40% of depressed individuals. So again, those markers are really important to look at, especially if people have Bartonella or Babesia co-infections. Okay, so let's go into treatments. I have about 15 minutes, so I'm trying to keep track of time. Okay. So, of course, I'm a naturopathic doctor, functional medicine trained as well. I'm going to focus on the integrative treatments. I will touch upon quickly antibiotics. It's a lot of training for that. We do have, when I do my boot camp, the great thing is we have multiple guests that come in that are Lyme literate doctors, and we have open Q&A. So we have recording. We basically have recordings of videos that we go through, and then live session for Q&A to ask anything that you like, particularly case studies, because I think that's the hardest part. I'm here sitting, explaining, going over information about Lyme disease and treatment, but it's different when you actually start doing it in practice. And there's a lot of nuances. But the first thing you have to do is actually start. The first thing you have to do is test, and you have to start, because a lot of people did not start when they're 2 years, 3 years down the line and don't have a diagnosis. So this is what's great about the boot camp, is that we actually go through these cases to help. That's where the rubber meets the road. But let's go into some of the ones that have been most studied and known. So cryptolepsis is one, Juglans nigra, Polygon and Cupsidatum, which is Japanese knotweed, Artemisia, Uncaria tomentosa, Astis and Canis, and Scutellaria bicalensis, not latifolia, bicalensis, have been studied to show to be effective as antibiotics, particularly against Borrelia burgdorferi. These have also been studied to be effective against Babesia and also Bartonella. So this slide deck just gives some studies on some of the herbs, how they're working. I love cryptolepsis as well as Artemisia, particularly for people that also have autoimmune conditions, because it has shown to be helpful. So you see about 93% for cryptolepsis cure rate with malaria in other countries compared against chloroquine treatments, and also studied for Babesia and multiple other benefits. Artemisia, very similar, studied for Lyme disease as well as Babesia, and also is shown to reduce short-term memory impairment when combined with IV antibiotics in patients with Lyme disease. And then we also have, yes, other information about how it's been used. Also, you'll see it's antiparasitic, so some people will also have improvements in gut health. So Artemisia, Angiographis, they also can help with the gut microbiome. So you may see changes in that as well. Scutellaria bicalensis, as I mentioned, neuroprotective. It's also very supportive for an inflammatory response to the body, and also is highly rich in antioxidants. Like I said, I don't know why. I emailed this to myself. I don't know why it's changing a couple of the fonts for some of them, but Japanese knotweed, it's been studied to show against log phase spirochetes and stationary phase. So what that is, people that are having more of those persistent infections. So this is a great one to consider: Japanese knotweed, oregano, Artemisia, these that help with people that have said they've had post-treatment Lyme disease or have struggled with Lyme disease for 20 or 30 years. What happens is the replication is so slow that it allows these spirochetes to hide for a period of time and be dormant. And so these antibiotics, or sometimes even herbs that people use, don't work as effectively. And so the best time to really get it is when it's really active. And so these, like Japanese knotweed, has been studied to help against the stationary phase of Borrelia burgdorferi, also neuroprotective, and it's protective against, again, dormant persister forms that withstand long-term antibiotics. And some of the antibiotics can change these infections into round body forms within 4 to 6 weeks of being on them. The active constituent in Japanese knotweed being resveratrol. Alcornea cordifolia is another one that has also been studied. These are just links and studies. Cat's claw, great, especially if someone has an autoimmune condition, has been used with rheumatoid arthritis, heavily studied. But you do have to be careful if someone does have certain medications that they're on because it can interfere with cytochrome P450. So this is one of my favorites, Atoba parafolia. It's an herb that's in Central and South America. Both Uncaria tomentosa and Atoba parafolia have been shown and studied at University of New Haven and against spirochetes, round bodies, and the biofilm because they produce biofilm. And so this has been studied against Borrelia burgdorferi as compared to doxycycline as shown to be as effective, if not more effective. And one of the reasons, what I love about herbs is that it's also helping with things like I mentioned, the gut microbiome, or it might be helping with immune regulation and immune function, which is really important, especially if someone's been on antibiotics for years and when they get off, they don't feel well. It's oftentimes because their immune function is still dampened or weakened, and we need to support that as much as possible. And so using herbs may help to actually support other things that you can't always get by way of like conventional medications. Hudatunia. So Hudatunia is also one that you used for Bartonella, has been studied. Mycoplasma has also been shown effectively for RA. And also the great thing is it's been studied for more like bronchial respiratory infections. One of the reasons why I like to do it for mycoplasma, for someone with mycoplasma and with Bartonella, as well as angiographis. So angiographis is another one that's been studied, acts directly on the host immune system for Borrelia, but it's also great for respiratory support. So if someone is having respiratory issues, especially in the wintertime, angiographis might be one you want to consider. Seta acuta, another one that is from Central America, helps with co-infections, studied against several things, bacteria, virus, and fungi. And then astragalus. So astragalus is a great one I put people on for immune function, has been studied for Lyme disease, and also has been shown to help with cardiac function. So about 5 or 10% of the population that does get Lyme disease can get Lyme carditis. You can also see that with Bartonella. So you'll see people that have these changes like tachycardia or hot symptoms, things like that, that will change. An herb like astragalus is great because it's supporting the cardiac functioning, but it's also helping as an antimicrobial. And then we have things like stevia. So stevia, oregano, lumbrokinase, nattokinase, serrapeptidase, these all help with what's called biofilm. So Lyme and tick-borne infections produce a lot of biofilm, which allows it to hide and evade from the host. So what you need is in any treatment, even if you're doing just antibiotics, that the patients you have are also on something to break up this biofilm so that the treatments you provide could be more effective. So stevia has been studied against like triple form antibiotics, has shown to help to eliminate the log phase spirochetes and the stationary phase persisters. Also helps to normalize cytokines like IL-6, TNF alpha, IL-1 beta, and NF kappa B, and also helps somebody with supporting cholesterol. So if someone has chronic disease conditions or type 2 diabetes, this could be a great add-on. So I always look when I put herbs on what can impact 3 or 4 things at once, so we have limited amount of things people are on based on their full intake. Nattokinase and lumbrokinase I mentioned, especially if someone has elevated, let's say, D-dimer or after being ill, that helps to break down fibrin-based proteins that hold the biofilm together. And then these are just some core protocols people use. So this is not to, I'm going to go over this really quickly because each protocol in itself, honestly, could be like 2 hours. But the reason I wanted to mention these is because they're common integrative treatment protocols that are used in practice for Lyme disease and tick-borne infection. So I want to make sure to just highlight them quickly, but for you all to go back and look into them because patients may come to you about, oh, I've tried Buhner's protocol or I've tried Cowden protocol, et cetera. So you're aware of this information. So the core protocol for Buhner's protocol is angiographis, cat's claw, and Japanese knotweed. And then there are some other additions to that. Cowden's protocol uses 14 different products, rotates every 4 to 6 weeks, typically about a year in treatment. And it's about 14 to 15 to 45 drops 2 times per day. And usually some people like me, I use a modified version in my office. But the goal is to eliminate spirochetes, round body forms, and biofilm. And the other cool thing about the company, particularly it goes also to, there's also profits that go to charity, but it has multiple, but this one has also been, their products have also been same as some of the herbs and Buhner's protocol. We talked about andrographis, we talked about artemisia, we talked about cat's claw, we talked about cryptolepsis. These have also been studied to be as effective as the antibiotics. And these two, Cemento Bandrol, have been studied with Dr. Horowitz and published and shown to be 70 to 80% clinically effective in advanced Lyme cases by the 6-month mark. Byron White. Byron White is a common formula, 40 formulas to help to support an individual with Lyme disease. And typically it's a lower dosage. It's highly concentrated. There's not necessarily a specific protocol, but these are some common ones. So the drop amount tends to be lower. Then we also have Beyond Balance, which is glycerite. So oftentimes you might use for children. It's non-specific formula, but they have 40 different products and the drop account is about similar to the other ones. Now, the other thing you want to make sure you're doing is Herxheimer support. So people once you do treatment for them, people have what's called like Herxheimer or what's called a Herxheimer response in the Lyme and tick-borne world. Also in like autoimmune conditions, you would consider like a flare, so equivalent. So I always tell people it's not new symptoms that you're going to get. It's the symptoms you already may have that can get worsened. And so you want to support people typically if you have more lactic acid, like certain environments, like if someone is like exercising or they're in a humid environments or certain environments, they might get more aggravated too with the Herxheimer response, but also initially in treatment. And so you want to be able to provide supports of what it is that you do when you have that Herxheimer response. So alka-seltzer gold is one. They're bicarbonates that help to create more alkalinity in the system. Turmeric is another, about 2,000 to 3,000 milligrams a day. Boswellia, which blocks the LOX pathway versus turmeric blocks the cyclogenase pathway. And then quercetin. Quercetin is a great one because it also blocks both of them. So these are ones you want to consider. Molecular hydrogen is another one to help as a Herxheimer response when someone's on treatment. Other ones, so low dose immunotherapy, low dose allergen. These are about a couple hundred practitioners trained in this by Dr. Ty Vincent, which helps to balance both the T helper cell 1 and Th2 balance. And then this is just a quick overview of conventional medication treatment. So typically with Lyme, you're looking at doxy, tetracycline, amoxicillin, azithromycin, cefuroximine, and rifampin. Sometimes some people are even doing dapsone, pretty strong. And so sometimes if you have a patient, for example, that has mycoplasma and has Lyme, they may do things like azithromycin might be a good combo with doxy for a certain period of time. Bartonella is typically double combination, as well as Babesia, where it might be 2 or 3 antibiotics given at the same time. And then some people, if your patients do have these EBV, the early antigen, the titer's really high, and their symptoms of, let's say, fatigue are higher, it might be indicated to look at treatment by way of medication as well. Some other pieces that are looked at by way of medication is LDN, which is an opioid antagonist, typically going up about 1 to 4.5 milligrams, as high as 6, depending on if it can impact people's sleep or it can help them. And as we know, some people negatively impact sleep, but it does help to modulate the immune system and alleviates pain. So this is one that I definitely like, especially if I have patients that have tick-borne disease and autoimmune conditions, because it can help with both things. IVIG. IVIG is another one. People do antibodies for immunodeficiencies about once a month. Treatment's about 3 to 4 hours, but it is a little bit pricey. And then some other additional treatments that have been studied, hyperbaric, typically at a lower pressure, 1.3 to 1.5, helping to reduce inflammation and improving immune function as well as neurons. So I see it help a lot with neurological disorders. Ozone therapy. So ozone therapy is another one, not FDA approved as though. Sauna. So sauna is one that is a gentle one I often recommend to patients. That could be a whole nother hour presentation as well on sauna and cold plunge therapy and things, which I've done before as well. And that you have to be mindful, especially when you have someone do things like sauna can definitely help, but you have to be mindful of the length of time initially without having a Herxheimer response. SOT. So SOT treatment's another one, more pricey. It's often when people do after the other things may or may not have worked well. And then also things like peptides, stem cell therapy, hyperthermia, et cetera. So these are just some other immune support things I wanted to mention: vitamin A, vitamin D, zinc, L-lysine, licorice root, especially if there's adrenal issues. But vitamin D, I just wanted to point out, helps as expressed on the B cells, T cells, and antigen presenting cells. But it has shown that vitamin D deficiency is connected with increased progression of RA, SLE, and mixed connective tissue disorder. Turmeric is another one I like, and astragalus. And then you always want to make sure you always start with also prevention, right? For us being in the space for integrative medicine, we always want to look at what do we do? Who is going to be at the highest risk? So the people are highest risk: farmers, gardeners, landscapers, people that work with animals. What are you going to do to support them as much as they can to prevent constant like reinfection? And so these are the people you want to be on a lookout for. One of the books I love, Dr. Alexis Chesney, on preventing Lyme and other tick-borne diseases. That's a great reference for patients like that are in these high-risk populations, because it includes even tick identification and other things as resources for patients, including things like this of how to have your home, where to look at, what are the areas that are more you have to be more mindful of. It includes resources on permethrin, which treated sneakers and socks showed 73.6 times less likely to get tick bite than with untreated. So in the summer months or spring months, having shoes treated to help prevent the likelihood of getting a tick bite. There are sites like Insect Shield who last 70 washes, and it shows a 99% decrease in rate of tick bites. Cedar oil. So cedar oil people often use on their spray on their lawn has shown to be as effective as DEET as well as picaridin. So picaridin's one that we use pretty frequently here in the office, very popular in Europe, EPA registered repellent, and also helps with mosquitoes. And another thing is all the other proper care. So how are you educating your patients when they go outside wearing like light clothes so they can actually see if there's a tick? Making sure they wear a hat, making sure they wear socks when they come in from the house. Does everyone in the house check, especially their pets? My dog is always coming back, even when she walks in the middle of the road with 3 ticks in the summertime. Taking those clothes off, putting them in high heat, but also what are those checks and standards you're doing? They tend to go in burrowed areas like the scalp, the hair, the underarm, the groin. So this is all information, especially now as we're going into the spring months or the replication cycles, to give these reminders and informations to your patients on what to do by way of prevention, even things on like how to actually properly remove a tick and to make sure to remove it fully, where to get something for a tick remover, and all these other basically prevention strategies. So, wow, I'm perfect on timing. Okay, so I have 6 minutes left. I thank you everyone for the presentation. Like I said, it was jam-packed. I had tons of stuff I said, but I wanted to make sure I got to at least go through Lyme disease, Bartonella, Babesia, the co-infections, and then the other things to look out for as you're doing your DDX and workup, and some common integrative treatments that are used. But if you all join me for the 6-week boot camp, which we'll have soon, you're going to get a much deeper dive into some of these things, especially on the co-infections, which tend to be trickier, where we go through case studies and it's collaborative. But this is my information to follow me. And then on Instagram is probably the easiest way to connect with me at naturopathic.physician. And I'll leave it open now for Q&A, and Adrian, if he has to say anything as well.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.